So, starting with the basics, when we say Bacopa, we mean Bacopa monnieri. It's an herb native to India with a long history of use in Ayurvedic medicine. You'll often hear it called Brahmi, but that name isn't exclusive to Bacopa. It's also sometimes used for gotu kola. So, quick heads up, Bacopa is not the same as gotu kola.
Yeah, and there's interest in Bacopa for Alzheimer's disease, and some preliminary data seem encouraging. So, starting from this before we get to the people, we're going to think about animals or lab studies if they're there. And for example, in an animal model of Alzheimer's disease, a Bacopa extract increases some measures of memory.
And that's a great foundation, Jeff, because animal data can tell us something about its potential, but does that translate to humans? And as it pertains to human studies, Bacopa is one of the more studied memory supplements, but the results are mixed. In healthy adults, those without cognitive impairment, it hasn't consistently improved broad measures like working memory or learning rate. That said, some subgroup analyses have found improvements in more specific areas like reaction time or verbal learning. It's also important to note that the evidence remains mixed regardless of whether a patient takes it alone or in combination with other ingredients such as ginseng. So, the next question we want to consider is what does the evidence say about people with cognitive impairment?
Yeah, so turning to that patient population, Andrea, the evidence is also somewhat mixed in those cases as well. So, for example, we have one clinical study in older adults with mild cognitive impairment. And in that population, taking an oral Bacopa extract for about 2 months improved again some specific areas of cognition, like attention or verbal fluency, but not other areas like working memory. This was compared to placebo. So that was kind of a short term piece of data. We also had a longer term study in patients with mild cognitive impairment or Alzheimer's disease, used Bacopa for about 12 months, so longer duration here. But it didn't improve measures of cognitive function compared to their baseline performance or to using a traditional drug like donepezil. So we see some mixed results in our patients with cognitive impairment. That could be due to the different kinds of patients that were in these studies, how long they were followed up, or other factors like the Bacopa doses that were studied.
Okay, so if the benefits are inconsistent, the next practical question is what do we need to watch for on the safety side? So, Jeff, can you walk us through what to consider?
Yeah, so big picture, Bacopa is generally well tolerated, but it does have some common adverse effects, including GI upset. And other adverse effects like flu like symptoms, fatigue, and palpitations have been documented in some of these studies, but those things are fairly infrequent. So I think our bottom line here, Andrea, on Bacopa is that the evidence for cognition is mixed. Sometimes we might see small benefits in certain subdomains or submeasures of cognitive function, but that means often, for many people, there's no meaningful change.
So, I think if someone wants to try it, we want to set expectations and then monitor for side effects, especially those GI issues like cramps, diarrhea, and nausea.
Agree.